Celecoxib. For Celecoxib, we have dose of 100 to 200 milligrams OD, or you can give 2 times, right? So two type of drugs, not two exactly, but 3 types of drug which is available for Celecoxib. Either you can have it in like 100 mg forms, 200 mg, or 400 mg. Now this 400 mg, 200 milligrams twice a day, which will come out to be 400 milligram, or you can give 400 mg once a day. So overall, the max dose will be 400 per day, and beyond that there will be a risk for GI bleed. So GI risk for bleeding will be beyond or equals to 400 mg per day. Right, and next is the onset of action. Now the onset of action is pretty late as compared to other drugs, which is about 1 to 2 hours. Most of the other NSAIDs start within like 30 minutes of time. Its peak is somewhere at around 3 hours. However, the duration of action is pretty long. Duration is 1 to 2 days. Among the whole NSAID, Celecoxib has the longest, right? Celecoxib or etocoxib, they have the longest duration of action. Among the Celecoxib and the etocoxib also, Celecoxib has the longest duration of action. Duration of action from 24 hours to about 44 or 48 hours. Now, for indication of Celecoxib. Now, before writing down the indication, let's check the Celecoxib over here. Celecoxib number 10, right? Now, the Celecoxib has okay analgesic effect, very low antipyretic effect, but it has a very good anti-inflammatory effect. And among the whole table, the risk of gastric bleeding is the lowest. So how nice drug it is, right? Very nice drug for anti-inflammatory. However, kind of better than piroxicam, because piroxicam though has the highest potency for anti-inflammation, but at the same time it was causing huge risk for the gastric bleeding. The Celecoxib has a little bit less anti-inflammatory action than piroxicam, but it has the least the risk of GI bleed, which makes Celecoxib a very better choice. However, Celecoxib has some other side effects than GI bleed, which is much more worse than actually GI bleed. Celecoxib and etocoxib, though they were causing the lowest risk of GI bleed, both Celecoxib and etocoxib, they increases the risk for thrombosis, MI stroke, and other stuffs, right, which are actually much more deadly and has the highest mortality, and it can actually kill the patient, right? So again, before prescribing somebody Celecoxib, check the patient conditions and other stuff before giving Celecoxib. Now for the indication, again, because it has a very good anti-inflammatory effect, right? So we can give it in arthritis, acute pain, and dysmenorrhea you can use. These are like main indication, right? Because see, in every kind of NSAID, we can make the usage of that drug according to its 3 main action of analgesic effect, hepatic effect, or anti-inflammatory effect. Now because Celecoxib doesn't cover antipyretic effect that much, so it is like a kind of useless drug for fever. Also, the pain component is not nicely covered, but still a moderate effect can be used by the Celecoxib. However, the anti-inflammatory condition, all those chronic inflammatory conditions, we can prescribe the Celecoxib considering the patient has a nice cardiovascular system health. So right, Celecoxib, right? Now, though the risk for GI bleed is less and the duration of action is pretty long, so we don't have to give so much amount of drug at once. We can give a small amount and the patient can have a relief from the symptoms. However, if we suspect that the patient might have a risk for GI bleed, at that time we can prescribe the patient PPIs. And PI for Celecoxib is dexlansoprazole. Dexlansoprazole, again, similar to other PPIs, it must be given once a day, and it comes of 30 mg. Right, so for the Celecoxib, it is always give dexlansoprazole. This is the most nicer combination. Celecoxib and dexlansoprazole. Again, you can give any, but already discussed why we should not actually give other PPIs. Right, now let's talk about some combination. Now, because Celecoxib lack antibiotic effect, it doesn't have that very good pain coverage, so we can add up other drugs which will cover all this lacking things of Celecoxib. So Celecoxib plus you can give tramadol in case of huge pain because it was lacking that pain component, so add tramadol with it. Likewise, we can also decrease the overall dosage of Celecoxib. Second is Celecoxib plus paracetamol to cover that fever and pain, right? The third will be Celecoxib plus ceratopeptidase. Now this thing actually helps for post-trauma inflammation, right? You can give this combination. And lastly is for the muscle stiffness, spasm, along with inflammation, you can prescribe Celecoxib with thiocoside. All these are the main 4 combinations which are found in most of the other NSAIDs which have similar kind of effect of that of Celecoxib. So this was all about Celecoxib. Next we'll talk about Etocoxib.